Hi, Julie. I think most of you've met me. I see a lot of familiar faces in the audience. I see some people that I saw again last night. My name is Julie Fortier, and I am running to unseat Mike Bost. If you don't know, to give you some background on myself, I am an Air Force veteran. I served 4 years in the United States Air Force. I'm sorry. I usually walk around, Paul.
Take it off.
Then I'll trip. I spent 4 years in the Air Force. I was in communications. I did computer work. I tell people that when I lived in Germany, my stuff stayed there, and I traveled. You would commonly find me working and living out of a tent near a runway. I spent 4.5 months in Desert Shield, 2 days in Desert Storm, and then they shipped me back for an emergency at home. And then I got stationed at Scott Air Force Base in 1991, and I have been here ever since. I worked full-time to complete my bachelor's in both math and biology. I do know what it's like to work hard to get the job done. I've worked for wages. I've worked for tips. I've worked for overtime, and I've relied on overtime at times to really help my income. So I understand what that's like, despite what Bost seems to think the big, beautiful bill will help us with that. I have been without insurance before, like many of you probably have. I will tell you, the people that designed this bill have not. They don't know what it's like to have the fear that you will not be covered. And I was young. I mean, nobody would think you would get sick, but I was afraid of getting in any kind of car accident and that insurance wouldn't cover it. So I actually got insurance through my employer. I spent 1/3 to 1/4 of my entire month's income on my insurance. And it still wasn't great coverage, but at least I had coverage. Until Obamacare came out, I was horrified with having any kind of pre-existing condition. As all of us get older, things are found out, things are discovered. And since that came out, when that came out, I was like, I can actually switch insurances. Because my husband and I were talking, I'm like, you can't quit your job yet. He didn't like his job. I'm like, no, because we can't have a different insurance yet. I can't afford not to be insured. He still stayed with me. And Obamacare came out and it helped that. And now, I was listening to a bill today. There is a podcast I listen to. She is a breast reconstructive surgeon. There is a bill coming out that is on the floor soon. I have to figure out when it's going to be signed, and I'm going to see how Bost signs it. And I don't know if you're aware of this, but it limits what a reconstructive surgeon is allowed to do for a woman, and it benefits the insurance company. I was horrified. People don't realize, the people that signed this bill, I don't care if you're a man or woman or what race you were, if you sign this bill, you don't know what it's like. You don't know what it's like to have a cancer scare. You don't know what it's like to be sitting in a robe wondering if they're going to come back in the room, is it good or is it not? Is it your first biopsy, your third biopsy? It's horrifying. And then to think that you're not going to be insured or not going to be covered, or if you have to have, God forbid, like you have treatment, that the insurance company can go to substandard or go to practices that were done 10 years ago because it's cheaper. It's not okay. I'm sorry, what? Oh. So I will tell you that a vote for me, people have said, stop saying you'll fight for me, but for insurance, for medical insurance, it will be a fight. But it is not a fight I am actually willing to give up. It is a fight that everybody in my family has had to endure, and I would love to use Charles as a resource, because you seem to be a wealth of information, and some of our data is different, so I want to make sure that I have the correct data. because facts, I have a PhD in biomedical science. I only rely on facts. Those are the only things. I don't make judgments on emotion. I don't make judgments. My daughter hates it, but I just don't. Give me facts. Give me stats. Give me numbers. Give me correct stats, because you can make them look however you want. But that's the only thing I will be making decisions on. And I have a friend, she's my best friend, hates politicians. And when she found out I was doing this, she kind of went quiet. And her comment to me was this, and it was a fair comment: be different. Don't stand up in front of people and promise the world. Stand up in front of people and tell them how you're going to fix things. And so my goal, I truly do not know how to fix where we are from insurance to where we are going. We will not have universal health care in my life to where it is entirely paid for. I can tell you that now because of the system that is in place. I totally agree with Charles. I will not see it in my lifetime. To move from where we are now to there would be mountains. And I understand what it would take. But what I do want to do is I want to see what other countries are utilizing. Other countries pay a lot of money right now in their taxes. Americans aren't going to want to do that. I mean, they just won't. And then we have the insurance companies that are intercalated into our system. And as you had mentioned, it's over 25%. So what I'm going to do, though, is I believe in facts, I believe in research. It's actually what I've done for all of my life. And I'm going to see what other countries do, how they utilize it. I'm going to see how other countries are enabling the cost of drugs. Your drug costs over $273,000 a year. The drug on the that I happen to be working on, I work on multiple myeloma, $888 per pill a day. That's over $360,000 a year. I have read charts from patients, and it will say patient has no insurance, has to decline meds. That's not okay. It's not okay. We have to figure out, there are other countries that cap the total that they are willing to pay. There's a drug that I'm very familiar with, almost $6,000 a month. Canada pays $800. We need to do better. We have one of the brightest, most advanced science in this country. I know because I work in it. I work in it daily. I have worked in it for over 20 years. And yet, we can't utilize it in some of our people because we can't afford it. That's not okay. It's not. So, what I'm asking is this. I may not have all the answers. I am willing to do the research. I will be in your, I will be doing town halls. I will be in your backyard. I will listen. I want to know what your concerns are. But when I go to Washington, I will have your back. And I believe, my friend who hates politicians asked me today, she goes, there was a governor in New Jersey. She just got elected. Somebody asked her, what's the biggest problem in our country today? And the politician floundered. And I thought for 2 seconds, and I said, hands down, it's our medical care. It is our medical care. Because if you don't have a healthy population, if you freaking don't get them vaccinated, God forbid, if you have people who are charlatans at the helm, who tell you to drink apple cider vinegar and that'll cure everything. But if you have people who don't believe in science, and if you have people who think it's okay for 42 million people not to have insurance because we can't afford it anymore, our population will be sick. And you don't want the cost. It is a lot more expensive to start healing somebody when they have advanced disease than when you can catch them at the beginning. And so we do need ACA. We do need Medicare. We do need Medicaid. This is not okay right now. Where we are heading is not okay. But if you elect me, at least we'll have a voice to try and head in the right direction. Thank you.
I just want to. It's easier. I just want to add to that Julie works full time. She has to work full time because you know what she's. Yeah. Oh, ouch. And she has a very big district, so she's going to do her best to get to it all. But she can use help. So volunteer to help if that's something that you really want to do, and I'm sure she can tell you how to do that.
I have a business card if you don't have it, and we have on my webpage, it's actually a volunteer page, and if you go on there, you're welcome to sign up for any facet that you are comfortable in doing. I will be doing town halls. Okay, my daughter's a senior in high school, but she thinks she's in college.
It's a big thing, okay?
It is.
Senior.
She's 18 today, so, but I do have my sons at Purdue. But anyway, so I will be doing town halls. I have been making the rounds, like I'm going to Harrisburg next week. I do know what El Dorado is. So, and I also want to visit the hospitals that they want to close. There are 6 in this district, guys. And those hospitals are crucial. They live in the farming communities. They live in the rural communities. And I was speaking to a farmer, and I said, people don't understand. I have worked on a farm. I've loaded more hay bales than I'd like to count. It's dangerous work. And other than just the farmers, when you remove those hospitals that are so crucial to those communities, you now have people, as the young lady had mentioned, driving 40 minutes to get care. People can't wait 40 minutes for a heart attack. You can't. So, well,
Are you ready for Congress?
I am. I'm running
You're running against Bost.
Yes.
Good.
It's just, for a national level though, the things like when Trump cut the funding for all of the, I used to work for a nonprofit, so he cut the nonprofit funding, he cut the funding, and like when he cut the funding for the Mayo Clinic, that was a huge thing. It's like, not only are we losing right now, those researchers who are the American researchers who are doing the work, we're gonna have a brain drain because they're gonna go to other countries.
They're already leaving.
Yeah, they're leaving to go to places where they can actually do the work that they need to do. We're just losing everything.
There is so much funding being cut where I work right now, because that's what I'm in research. I have a friend that has been working on a drug. In fact, I had a conversation with her yesterday. She's been working on the drug for 5 years. It is a individual drug that is, it's made just for a person. And she's been working on it for 5 years, and I found out yesterday that her research will take her at least 1 more year before it goes into humans. It's time, it's money, and Trump is gutting it. Because he doesn't, his freaking, for anybody, I know a lot of people that couldn't stomach watching his his January, no, his 60 Minutes thing was bad enough. No, watching his union address in January or early February, and they talked about transgender mice, and I about fell out of my chair.
Oh, yeah.
Yeah.
I have made genetic mice most of my life. I mean, it's just, and to sit there and go, you have idiots that are talking about things they don't understand. His entire administration, but when you specifically look at the medical aspect, firing all of CDC, one thing I would love to do, and this is when I get elected, I am going to write a bill that writes requirements for every administration, meaning you have to have 20 years of service as a physician before you're in the CDC, and you have to have at least 100 publications. You have to have at least a 2-star general with 4 years at that time and grade before you're allowed to work for the Department of Defense. This is ridiculous. We need leaders.
Yeah.
We don't need charlatans. We don't need Fox News people. We need freaking leaders.
Exactly.
And if you can't do the job, get the heck out.
And we're not even gonna even have CBS. They said, Sunday I was watching a program and they're only 2 months away for developing something for Alzheimer's, and it's cut.
Yeah, I just saw that too.
2 months away from getting it.
You can't start a lab up in a day. When you cut a lab and you cut funding, cells are
Well,
gone. It's years.
Yeah, when I'm looking at,
Right.
like your case where you've got 6 years into an 8-year study, well, you can't just go, you can't just go, okay, well, next year we're gonna do the funding again.
That's what
She's
people
not.
ask me. They're like,
She's
maybe
not.
it'll start again.
There's no
And
getting
then
around
it's too
it.
late because
Yeah.
people have already missed doses
Right.
Exactly.
of that drug,
Exactly.
and so the trial is ruined.
Exactly.
They killed their animals too. Some of the labs had to kill their research
Yeah,
animals.
because they couldn't afford them.
Because they couldn't afford them.
Well, guys, it's 10 after 9, so we kept you extra late. I apologize for that. I hope you got a lot out of this. There was a lot of information there. I really want to thank all of our speakers who came and told their stories and shared the information that they did. So let's give them all a big hand. And we all have to go make sure we need to contact our senators and our congressmen and let them know what we think about what's going on with healthcare. Okay. Thank you all for coming tonight. Grab a cookie on your way home. Thank you so much.